So this evening, I'm thrilled to be joined by Dr. Whitney, who is going to tell us, answer all of our questions about parenting and balancing motherhood and parenting. So before we start, though, my name is Erin O'Connor. I'm the Chief of Education here at Cooper and also professor at New York University. And Dr. Whitney has such an extensive resume. I would love for you to just introduce yourself and focus on your.
Yeah, awesome. Okay, so by training, I am a pediatrician. I'm Stanford trained pediatrician and a public health expert. So I went to University of California at Berkeley, got a specialty in maternal and child health. So I have a master's in public health in that. And I've been practicing for about 12 years now and seeing patients in a private practice. So actively treating patients for all the bread and butter stuff, but also some complicated things that come in. And what we see over time, just like I'm sure all of you have experienced in the world, is that just more and more mental health issues and parenting issues that as pediatricians, we are responsible for kind of planting the seeds on what the next step is for taking care of it. And also figuring out when's the right moment to refer to a specialist or figure out what we should do then. And then in addition to that, though, I have a daughter who is autistic and another more neurotypical kiddo. And so that sparked me to begin a platform called Modern Mommy Doc that I started in 2017. And it's a blog, it's a platform. It has some online programs that you can take about navigating kids' emotions and parenting with your partner. And then I also have 3 books. One's about taking care of a newborn and yourself. One's about taking care of your kids when you're a working mom. And then my newest one, which is on audiobook right now, the rest of it's coming out in February, is called Doing It All, Stop Over Functioning and Become the Mom and Person You're Meant to Be. The entire platform is about helping moms to be that parent, be the person that they feel like deep inside, like this is who I want to be, but the world and their circumstances and all the pressures and all the messages are kind of getting in the way and making it so that they're losing focus. And Dr. O'Connor, sorry, helped me actually with creating an entire chapter in this book that was on the 5 most important things that matter when you are a parent. So if you're interested in that, we wrote it specifically to be able to apply to any kid out there. So if you have a Asperger's-esque kiddo like mine, if you have a kiddo who is nonverbal, if you have a kid that has ADHD, if you have a kid who has none of those issues, it will apply to them. And the hope on that chapter was just to give parents a lot of confidence that even if they feel like they're not doing every single thing that the internet tells them to do to be a good parent, they can still be totally successful. So that's me.
Well, it's always a pleasure to talk to you. And I think I love how, in our discussions, it's all about sort of boiling down like what matters and how we can become more sort of centered parents in this crazy journey we're all on, right, together. Um, and something that I think comes up a lot is worrying about our children, the only touchstone often being the pediatrician during, those first multiple visits the first year, but then sort of, only yearly visits as your children get older. Not necessarily feeling like there's enough time to ask all the questions you want to ask, and that creating a little bit of anxiety. So what we wanted to just kind of do tonight was delve into questions that folks had that they'd emailed questions in around just different issues that they have or concerns that they have with children of varying ages or about themselves. So let's delve in.
Love it. Do it.
Do it. So one of the first ones was, my daughter is 17 and a half months. I put her to bed at 5:30. She wakes up between 3 to 5 for a bottle. Any tips on how to help with that?
Okay, so there's a couple questions that if you were in my office, I would ask you first before I started giving advice. Number 1, I would say, is your child taking a bottle to fall asleep? because a lot of what happens, especially as we get into 17 or 18 months, and you can attest to this too, is that kids have a very strong amount of object permanence at that time. So whatever it is that they fell asleep with, they really want that to be there when they wake up. It's normal for us to wake up multiple times in the night. In fact, as adults, we do that. Usually like every 90 minutes or so, we end a sleep cycle and we wake up and we come up a little bit and then we go back down. But as adults, we've learned how to, and some kids have learned how to put themselves back to sleep when that happens. And so your child, I am assuming this might be the case, if they are receiving a bottle before they go to bed, then when they wake up in the middle of the night, they're expecting that bottle to be there. So never fear, we can actually break this habit. First of all, at 17 months, I would actually suggest trying to get rid of the bottle in the first place. So much better for their verbal development, good to have other things that aren't in the mouth for them to soothe themselves when they're feeling maybe upset so they don't get tooth decay. So lots of good reasons to not have a bottle. But if you were going to give a bottle before you went to bed right now, I would make it only water right now. So that way in the middle of the night, the thing that your kid has available to them is water. Next step would be, once you kind of switch over to water, switch from the bottle itself in the middle of the night to a sippy cup that's not going to leak all over the bed, right? So they can have their little thing of sippy cup that's there at night if they want to, but then if they wake up in the middle of the night, they have to like kind of work a little bit to be able to find that sippy cup. Then you don't have to be involved at all. The other thing that sometimes makes it so that 17-month-olds wake up in the middle of the night is if you are rocking them to sleep, or if you're singing them to sleep, if you're lying with them to sleep, if you are basically that additional like thing as a bottle that's making it so that when they wake up, they want you. So that's the other thing to kind of pay attention to is what is the environment when they're falling asleep. And hey, no shame. I've totally, if that's you, I've had my kids who are 7 and 10 be like in the room sleeping with me, and they've called out in the middle of the night, where are you, even now? So no shame, but those might be two things that are affecting your child's sleep and now are going to be affecting your sleep.
I love that, bringing object permanence in, right? Because it's such a big stage. So a very somewhat different question, but I find this too among my cohort of mom friends who have children this age. It seems like there's a more frequent suggestion to have children's adenoids shaved or taken out.
Oh.
Like, what is it? First of all, like, is that a new trend, or are we just more aware of it? And two, what is the difference between, or sort of the pros and the cons, I guess, of shaving versus actually taking out?
Right. Okay. So sometimes with certain kids, and depending on certain circumstances, your adenoids, which kind of are here like in your ear, nose, and throat region, can get inflamed or can get unnecessarily involved. So sometimes that can be if you have allergies. Sometimes that can be just anatomically, like maybe your mom had big adenoids, so you have big adenoids. Sometimes that could be if you have an infection and it's just kind of stayed inflamed. Think about on your skin, if you got like a pimple on your skin, that sometimes they stick around a little bit longer and they stay kind of inflamed or bumpy, and sometimes they just fully go away. So that can happen inside your body too, on different parts of your body. As a pediatrician, the biggest thing that makes me refer people for getting their adenoids either shaved or taken out would be if a child is snoring consistently in the middle of the night and they are having sleep apnea. Sleep apnea, a lot of times what it sounds like is this, like you're snoring and then you go and you hold your breath for a second and you stop breathing and then you start to snore back again. Now, if your child right this second has a cold and they don't normally snore, but right now they're snoring and right now they're having a tiny bit of apnea, that's no big thing. It's going to go away. Give it like a month. Probably they won't do it anymore. My poor little sweet 7-year-old, I cannot be in the same room as her now. It just sounds like a trucker, So if that's the case, give it a rest. But if you find that your child is consistently doing that, that's a good reason to go to your child's pediatrician and say, hey, I've noticed a lot of snoring. I've noticed what sounds like sleep apnea. If you can, record on your phone. So that way your pediatrician can hear what it sounds like. That's very helpful. And then the pediatrician is going to refer you to an ear, nose, and throat doctor. Generally speaking, in my community, people don't do a lot of shaping of adenoids. People do mostly just removal of adenoids if they're going to do that. If I could see where if anatomically in your family you just have large adenoids that are kind of large side and you just want to do like a small minor procedure, great. But if someone is to the point where they have the sleep apnea or they're having major allergies as a result of what's happening with their adenoids, most of the ear, nose, and throat doctors in my community will just do a removal of them.
That makes sense. So another question, which I think is so interesting because it's something that's happening in my household, and as a developmental psychologist, I have my own sort of take on it. But this idea of picky eating and
Yeah.
having, a 3-year-old who's right there, in the weight charts and everything, looks great, but all she wants to do is eat chicken fingers, and she would be completely happy doing that for her entire breakfast, lunch, and dinner. Sort of,
Yeah.
when do you start to get concerned about that sort of behavior, and what are some, sort of ideas for getting them away from this maybe very, very favored food?
Yeah, totally. Okay. So, first things first, remember this. We have picky eaters in America because we have an abundance of diverse food options, right? We are an industrialized country. We have tons of food available. Food scarcity, of course, exists in certain communities, but at large, we have lots of different foods available. If you were to go to Japan, for example, if you were a child, you're not going to have, if you lived in like a village in the countryside in Japan, you're not going to have all the different variety of things that we have. So those kids will not have pickiness like our kids do because they won't even know the difference. This will just be the food that they have every single day. So part of the reason that kids have pickiness in America is because of exposure. Now, I used to be so proud of myself when I had my first daughter that she was not picky. And I was like, oh my gosh, she'll eat sushi with eel on top of it. Like, I am like just raising this like cosmopolitan, amazing kid who eats anything. She'd eat mushrooms, all the things. And then what happened? She went to preschool.
Oh.
She was exposed to other kids, you know what I mean, who were eating like goldfish, and like my parents who would be like, can she have a Coke? You know what I mean? Like, ridiculous. So part of it is totally out of your control because I don't want you to think then, oh, cool. Then what I need to do is just have it be that my kid is only exposed to amazing foods and none of this trash. And I can just totally prevent my kids from being picky because we live in a world where we're in community and they're going to be at their preschool. Okay. So I'm saying that first just to let you off the hook a little bit when you feel bad about your kids being picky. Second reason that our kids express their pickiness, we were all picky too when we were younger, I'm sure. They express their pickiness is because we're not in our parenting style, generally speaking, as totally authoritarian about the way that we approach food. So I'm assuming that you're the same as I am, where I didn't make my kids sit at the dinner table and finish every single bite and have a clean plate club and spank them if they did not finish their food, right? Like that happened to some of us when we were children. And so we know that that type of parenting when it comes to food really causes some really stressful relationships with food over time, is probably in part, not the whole thing by any means, but in part of the obesity epidemic, like lots of things that were wrong with that. But it's going to make it so that when we look at our kids, we go, what? Why are you not as well behaved as I was, quote unquote, when it comes to food? Okay, so a couple things to remember. Now, that said, you do have some agency and some control here. This is what I would recommend. And actually, this is borne out in the literature as to the most effective ways to help parents not be as stressed at the table and kids not be as stressed and to have a healthy relationship with food over time as they're older, which is really has to be your main goal, as opposed to you just having control of what your kids eat in the moment.
In the moment, yeah.
Okay. Yeah. So what you want to do is provide at the dinner table in bowls. It doesn't have to be like on their individual plate, the foods that are available for that meal. Like, okay, we're having mashed potatoes, we're having some turkey, we're having some broccoli, we're having bread, whatever it is you're going to have. What you want to do is pre-plan in your head, what is one thing on this list that I know my child will have? right? So you're like playing a game to say like, I'm not going to act like I'm in control, but I am in control because I'm putting one or two, even three things on this list that I know that they will eat. But you're going to expose them to all the rest of the things. And when your kid goes like, oh, gross, peas, I hate peas, get those away from me. Unless they have an actual documented diagnosis of like food aversion or of a sensory disorder or something like that, you're going to say, you know what? It's part of life for there to be peas on tables. And so you don't have to have any, but here's the food that's available. Now, you can offer them then like a serving of each of the things. They're going to pick probably their three things they like off the table. Then they're going to go, I don't want anything else. I want just the potatoes again. I don't want anything else. I want just the chicken fingers again. And that's your moment where you have a little bit more control of the situation. And you say, listen, these are the foods that we have available here. We've actually already had a serving of that. You haven't had anything else on the table. If you're all done eating, that's okay. There will be other food later on. But right now, these are the foods that are available. And then you don't have a huge like drag out hardcore session. Why are you so bad? Why are you so picky? Why can't you eat the foods that I want to eat? Okay. So that's like as you're sitting at the table. Now, couple things in between then. After that meal, you're done. You can say the next food will be available in an hour. Okay. So it's not like your kid can then just go, okay, great. I'll wait a second till after dinner's done and then I'm gonna have this. The other thing is if there's like sweets and treats, I wouldn't use sweets and treats as a reward to get through the like bad foods. So if you want to give some treats, you're planning on having dessert with it, and your kids are not wanting the food that you're putting on, you know this is going to happen. They're going to go, no, I don't want anything. I just want dessert. Just have dessert be part of the meal, but just give them like a very small amount of the dessert on the plate and then say like, yeah, this is the amount that we have. And then if you want more of this dessert, great, we have to have the other foods because you haven't tried everything else. Okay, so then an hour later, what do you offer? Again, maybe there's going to be something else that you know they like, but also other foods that you're trying to introduce them to slowly. So you might say, okay, so your options now, an hour later, if they bring it up and say, I'm still hungry, are a yogurt, some carrots, and whatever cracker that you want to do, right? Whatever you're okay with. So those are the big ways over time to help with healthy eating. The other big thing that I've come across in my own house, and especially with a neurodivergent kid who has a real sweet tooth, is that sometimes just in general, she'll say like, I want to bake, I want to make cookies, or I want to go get a croissant, or I want to go get a hot chocolate or whatever. And I, of course, like I said, grew up in that generation of like clean your plate and like bad dieting modeling happening for me totally. And so I'm still repairing my own relationship with food and body image and all that, just like most parents out there. And so what I've learned to say to my child is, you know what? During the day, we actually haven't had enough protein. So that wouldn't be an appropriate choice right now. Your options now are X, Y, and Z. So I really try to make it about what the food is that I want her to have as options, what it will give her. Like really what you need to have to give yourself enough energy or to give yourself enough hydration or to make sure that we have enough balance is going to be a fruit, a vegetable, or this piece of meat right now, like whatever it is that she hasn't had enough of in the day or in the week. And that would be my last point is just focus on what you're doing throughout the whole week as opposed to what you're doing in the day. Like maybe one day is a total like cinnamon roll for breakfast and then cookies for lunch and then, popcorn for dinner, whatever. But then the next day, it's kind of like you and I, where if I Netflix binge watched all day long one day, like I better move my body the next day. Like, so trying to think about balance or about things being integrated when it comes to food and picky eating as more of a week-long or even a month-long endeavor, as opposed to every day or every meal. That's going to help you so much to take the pressure off. Because sometimes with that pressure, it's like, that's what makes it so much worse for our kids. They can smell the fear in us.
Totally. Totally. And in that moment, you're like, oh my gosh, if they don't eat the broccoli, it's going to be the end of the world. They won't have had their vitamins for the day. Get that back.
Yes.
So, that was so helpful. Another question that we got, which I thought was sort of interesting, was, is there a way to tell, let's say it's, 3 in the morning and your child has a rash. Oh my gosh, is
Mhm.
this rash or is it an allergy or like what should I do? Let's say they're not having breathing problems, but they just have this rash all over their body. Is that the time that you're like going to the ER? Or like what should you do in those sort of situations?
Yeah. Okay. So you actually like hit the nail on the head when you talked about breathing problems. This is actually the moment for you first to say, sick kid, okay looking kid. If your child is having trouble breathing, if their lips or their face or their limb is swelling up, if their eyes are all puffy, if they can't breathe out of their throat, if their tongue looks swollen, if they're like gasping for air or doing this, okay, that's emergency or even 911 to be able to get them the help that they need. If your child is sitting there and going, they look really bad in terms of the rash, but otherwise they look fine, then okay, you can take a breath and then calm down. So, different types of rashes that are the most common. Number one, I would say is a contact dermatitis. Derm is skin, itis is inflammation. So, dermatitis means inflammation of the skin. And so, contact is like something came in contact with it. So that might be they wrote on themselves with a Sharpie, or they're playing with slime again, or, my daughter, she put a bunch of face paint, like from Klutz, on her face, and then she broke out in hives all over. So that can be kind of just irritation, or can be an actual allergic reaction. And usually, step one in that situation is to give your child some Benadryl to see if that can calm it down. On the back of the Benadryl box, it talks about exactly how much to give, and your pediatrician can tell you ahead of time how much your child would need based off their weight, because it's a weight-based thing. And then if it's just one spot that they have the irritation and you think that it's from something coming in contact or a little allergic reaction, then hydrocortisone 1%, which you can buy over the counter, also is good. But there's all types of other rashes as well. Like there's a rash you can get from bacteria in a hot tub. Who knew? Disgusting, but possible. There's a rash you can get from, you have actual allergies, like from something that you ate inside of you. So something you put on your skin isn't going to make a big difference. There's the rash you can get from coming across plants. There's rashes that have to do with viruses. So actually, my number one tip, if you're worried enough that you feel like you can't wait till the next day to get help, would be to either call your pediatrician office, or one of my favorite groups out there is Blueberry Pediatrics, that has like board certified pediatricians that can actually like take a look at the rash in real time for you 24/7. So there's tons of new telehealth things like that that are coming out that I think for working parents in particular, these are godsends.
Yes, I will say I have used Blueberry Pediatrics, and
Mhm.
the moment when you're just like worried about what's going on, they're amazing.
Yes, exactly. And they don't try to replace your doctors. That's the nice thing, is that you can use them for like a one-off. So, and it doesn't have to be them, just something like that, like something where someone who is a professional can actually lay eyes on it, or call your doctor's triage nurses. Maybe you can send a picture, like anything that can allow you just to kind of get eyes on. The other thing I would say is, just having been a pediatrician and taken call for 12, 13 years, you're not bothering people when you call us. So if you're worried and your kid's not sick, so they're not doing all those things I talked about, but you feel like you can't wait till the next day, just give us a call. Like, we're happy. We'd be happier to have you call us than to rush your kid to an ER where they're going to get sick if they don't need to go.
I think that's so helpful because I think there is such that like guilt complex or whatever, where you're like, I don't want to bother.
Right.
Like, oh, I'm not, is this worth their time? Like, so thank you for demystifying that for us.
Yeah, we're getting paid. You're good. Don't worry about
So
it.
we had a couple questions come in actually. Okay, so when can you start sleep training? Our child is 8 weeks, but born at 37 weeks and 4 pounds, 14 ounces.
Okay, so sleep training is one of those hot topics. There's a couple factors if prolonging the amount of sleep, you intervening with prolonging the amount of sleep, you have to consider. So number one, to me, it matters less what your child's actual size is. It matters to me like how they're doing in terms of gaining weight over time. So your pediatrician is actually going to be the best person for your individual child because they can see over time on the growth curve. Are they feeding well? Are they gaining weight well? Are they pooping well? All of those things. Next, I would really consider what sleeping through the night means and like what the goal is of sleep training in the very beginning. So to me, sleeping through the night as a pediatrician is 5 hours of consecutive sleep. So I know that's not a lot for a lot of parents. So you might need to, before your child is ready to sleep 5 hours consecutively or longer than 5 hours, you might have to address your own sleep needs separate from your child's sleep needs. Like it might be that what you need to do is with a neighbor, be like, hey, I'll give you a DoorDash gift card if you'll come be the person that wakes up, or getting a doula, or getting your partner on board, or getting extended family to help, or getting other friends in your neighborhood. Like to me, getting moms in particular, dads too, the sleep they need separate from their child makes it so then they don't push their child to go faster than they need to on getting extended hours of sleep. So just consider that. And I know, of course, that again depends on how, what your means are, how available people are in your circle, but sleep's my number one priority just as a person. And so I think whatever you can do to get people to help in that regard is always worth your money. Second is, in terms of sleep training, the first thing I talked about with breaking those associations is actually the very first step in sleep training. So you actually don't have to choose, like, am I going to do cry it out? Am I going to do, Ferber method? What am I going to do? You could just simply say, I'm just not going to give a bottle as my last thing before my baby goes to sleep, so that way they don't have that association. That is sleep training. So that can happen at any age. You can do that like from the very beginning where, you get them up, you feed them, you play with them a little bit, you hold them, and then you put them to bed. So I recommend doing that from day one as much as possible with your kids. That said, for most kids, in terms of being able to do what we call like traditional sleep training, it's usually 4 to 6 months. And the reason that we do it around that time is because, as you know, once we get to more like 6 months is when we start developing that object permanence, that ability to know that when something is not there, it still exists. And so at around 6 months, our kids start to realize, and it gets stronger and stronger over time, that, when we put our kids to bed, mom's in the other room, she didn't just like disappear into thin air. And so if you can catch kids kind of right as that is escalating, that can sometimes help you to prevent more sleep problems later on.
Great advice. So
that's a tricky one. People have like strong opinions about that one.
Really, excuse me, really tricky one. But again, bringing it back to I think really it makes it make total sense, sort of why we think about that 4 to 6 month period. I love this question because I remember I was so worried with my first about this. Should you be worried about green poop?
No, green poop's totally fine. You should worry about black poop, like black as in there's no color to it at all, like this color black, like that's no good. You should worry about red poop. That is a problem because we worry about bleeding with that. Same with the black poop, actually, because blood can look black when it comes out. And then the other color poop that I would worry about is no color poop. So if your child's poop is white, that can indicate that there's actually a problem going on with the liver or the biliary system. So kind of that liver gallbladder connection. So those are things that definitely I would call about. Green sometimes is if there's a virus and mom is breastfeeding, for example, if mom had a virus, it can make the poop green. If your child is eating solid foods, it can make the poop green. Or if your child themselves has a virus and they're just kind of working it through in their body, that can make the poop green. So no problem with green poop. The one caveat I'll say is when you're starting in the very beginning, like I'm talking about like the first 5 days of life, usually the poop goes from that dark black meconium to a green and then to yellow. So during that period, we actually really do want to see that transition because it just means your baby's getting enough food in the first place. And so everything is like moving along beautifully. So that's the one like exception to the rule. The other things that I would watch out for when it comes to poop that are worth mentioning to your pediatrician if they happen are if your child has a bunch of mucus in their poop,
Mm.
or if it looks like currant jelly. So if it looks like jelly, like on a peanut butter and jelly sandwich in like a peach color or reddish color. If those things happen, those also indicate some like weird and crazy things. So let your pediatrician know if those things happen. But green poop by far is the most common worry and totally normal, totally fine.
I called my pediatrician about green poop the first time. I was like, oh no, that's just what is it?
Yeah, totally, of course.
Right? All these things are so jarring at first.
Mm-hmm.
Okay. Is there something we can do to get larger feedings / longer periods of time between feedings? So same thing, 37 weeks, 4 pounds, 14 ounces. We are responding to cues, but drinking small amounts every 1.5 hours can be draining. Yes.
Totally. Okay. So, kind of same at first, same advice as the sleep advice. Maybe having somebody else do the feeding for you. So if you're breastfeeding, for example, pumping right after you breastfeed, so that way at that 1.5 hour mark, you're not the one that has to do it. Somebody else can do the feeding in the middle. So that's number one. Number two, pay attention to the flow of the nipple that you're using, because just like us, if we're drinking and we have to suck through like a really small straw out of a glass, it's going to make it so that we don't drink as fast and that we get pretty frustrated quickly. So I don't want it to be that your child is getting waterboarded by the milk or by the formula, but I do want to make it so your child isn't sucking through like a tight straw that doesn't actually get them the milk that they want. That's number two. And then number three is use a lot of stimulation during the time when your child is feeding. So if your child is just like sucking on the bottle or on the nipple, like, and they're not doing much, they're just burning calories and kind of wasting time. So you want to try to make it so that they're as active as possible during the feed. So in the newborn period for sure, but even after that, where like you're stimulating their back, you're kind of tickling their back, you're tickling their feet. You might be like rubbing on their head a little bit. You might be like doing the chicken wing with their arms. So that way they're a little bit more awake. So just trying to make sure that they're actively involved in the feed so that way they don't waste time and get bored with it or decide that they don't want it.
That makes total sense. I don't, what is your take on, this is an aside, but sort of like having a necklace or something that's like vibrant that they're interested in? Because remember went through that phase of the nursing necklaces. I think that still even exists.
I think, yeah, I mean, I would argue that probably the evidence isn't there. I don't know of any evidence that it helps, but I think, I think that sometimes maybe like zooming out, that sometimes just as parents in general, we look for what's like the hack or what's the thing that can make our kids interested, when really as a parent, actually you have everything that your child needs. Like your kid would be your baby, and your 1-year-old who's nursing or who's, drinking is just as excited to chat with you as they are to look at a phone or to look at like a feeding necklace or whatever. It's just about kind of capturing whatever it is that gets them going. So with my kids, I remember I would sing a ton to them when they were feeding. I remember that I would read my books out loud once I got like adept enough at holding everything. I would have it on my Kindle and be reading like my own books out loud to them while I was nursing. So that way I wasn't so bored. But I even think about that. Like I was just in New York or staying with my daughter and she's like, I want the phone. I'm like, let's do this. Actually I have it right here. Let's do this like totally random questions book together. Like we went through and answered all the questions, and she was totally engaged for an hour and a half at that restaurant answering questions with me. So sometimes I always just want to remind parents that your child actually does want to interact with you, and that it can be tempting to spend a bunch of money on all these things that make it so that they're interactive, but really they just want you.
Yeah, totally. I think that's a good lesson. So speaking of products, sorry, I had COVID like 2 weeks ago and I still can't fully kick the cough.
You're totally good.
So the snoo, what are your opinions on the snoo?
Okay, so I love devices. I know I just said you don't need like extra accoutrements, and that's true. But I love devices that actually help to mimic what someone can't do 24/7. So I like hello, sweetheart. Speaking of momming little ones. So the snoo and products like it, I find super helpful for the parents that I see who have tried everything, who have bought everything from Amazon, who feel like they're at their wits' end, who are starting to feel like failures when it comes to putting their kids to sleep and having them stay asleep. Because actually, if a snoo or a device like that tries to mimic what's happening in the womb doesn't work for your baby in particular, the odds are your baby or your child just needs a little bit more time to be able to get through that moment and to be able to sleep well. So I don't think there's anything wrong with products like the snoo. I think sometimes they can be helpful actually as like a data point. Because if you've tried every single thing, you've been trying to get your kid to sleep as much as possible, it doesn't work. And then you're like, fine, I'm going to get the snoo. And you do the snoo, and then that also doesn't work. I'm like, okay, well, then you probably just have a baby who is going to take a little bit of time for them to get over this. I would always, when it comes to products like that, rent them. I mean, now you can rent them almost everywhere. Just spend the $5 a day you would spend on a latte. Get that instead. I think that's so much smarter than trying to buy something like that.
And you don't have the clutter after they're not using it anymore.
Yes,
Yes, hands down, rent.
totally.
So this is shifting gears a little bit from sort of more baby focused to more mom focused, but we had a question in from a mom who's going back from maternity leave and she's very anxious. And sort of any tips that you have to help with that anxiety over, first leaving the baby with a caregiver. I know I went through that especially with my that return to work was really hard. Sort of some, ideas, tips on how to sort of position.
Yeah. Okay. So first, some philosophical things as I do, and then some practical things. So philosophically, number one, like accepting that this is a big transition and that you went through a big transition can be really helpful. So like just being like, oh, that makes sense. I feel conflicted about going back to work. Of course I do. Could I fill a coliseum full of other moms who would feel this exact same way? Totally, right? So just knowing like you're not alone and reminding yourself of that, validating those feelings, letting yourself be in those feelings for a minute, I think is super powerful and it's evidence-based. Number two, it might be that when you get back to work, you actually have a different feeling, which is a little bit of guilt. Like, whoa, I actually like being away from my kid. And I feel like I'm not supposed to like that. Like I'm a bad mom if I want to be at work. There's some amazing things about going back to work, like especially if you get to go to an office, like you get to use the bathroom without kids being there. Like you get to like actually eat lunch. Like there's some really cool things that happen with going back to work. So if you feel a little bit guilty, just know that you're in good company with that, but that's a very normal feeling to feel a little bit conflicted. Okay. And then practical strategies. So I would ask your employer if it is possible to do a little bit of a transition phase for the first couple weeks, so that you could do maybe like half days, or so that you could do 3/4 days, or so that you can have a little bit of a longer lunchtime if you want to go see your baby. Like that type of thing can make a huge difference. The weekend after you go back to work, I would plan nothing, because you're going to feel like, oh my gosh, now I haven't been home. Now I got to do the toilet paper and like do the laundry and like cook for the week and like get myself together. So just purposefully don't plan something big. And then the third thing is, I would say if you have a caregiver, do some practice runs. So even though it feels like, no, I want to spend all my precious time with my little baby as much as possible before I go back to work, it's better for you and your child to have you go to the store for an hour and leave them with that same caregiver and then come back. Or even if you weren't going back to work and you can't do the like easing into work transition thing with your boss, maybe you could do for yourself like half a day. You go to a workout class, or you just go to a coffee shop and you write, or you go for a walk, or whatever it is that kind of allows you to have that separation and for you to build some trust with your caregiver. And then the last thing I would say is with the caregiver that you have, just set some really clear expectations about what would help you to feel the best in that first week or two back. Like, do you want to see pictures or do you not want to see pictures? Or if you don't know if you want to see pictures, tell your caregiver, I'm not sure if I want to see pictures yet, but can you just be available to me so that way, if I do want them, you can snap them and send them to me? Do you want to be updated on every single pee and poop and meal, or do you just want the highlights? Do you want to have both you and your partner be updated about things? I'm a huge fan of equity in the workplace. And actually, when you go back to work is like one of the huge moments where that starts. And so maybe think about that, like to let your caregivers know, you know what, since I'm working and my partner's working, if you have one, it'd be great if you could actually communicate with both of us via email or on text message or calling or alternate call. If you have a male partner, call him first, then call me, then the opposite way. That sets it up for yourself that that's the practice that you're in. And that is like just as important as what you're having other people do with you is what you're practicing for yourself in terms of not being the default parent.
I love that. Like thinking of it as this transition point where you can sort of start to define roles and really think about how you're going to have that equity in the relationship. I love that because I feel like it's such an overwhelming time, and
Yeah.
trying to think about, okay, what, quote unquote, what do I want to get out of this, and that is the thing. Instead of trying to
Yeah.
negotiate it later on when patterns have already been established and it's a little harder.
Totally. Yeah. I mean, I think that so there was just a post that a person who's an acquaintance put out on LinkedIn today that said, not a quote, but a thing that was talking about how she had this really terrible night the night before with her kids and they woke up and she had to work today, but oh man, like it's so great because her husband's like a hero all night and he'd rock the baby to sleep all night. And I put back to the post, like, that's so amazing. And you're totally right that it speaks to how exhausted moms are. But the highlight of this, I think, is that you put that your husband was the hero all night with you, because I actually think most moms would not say that that's the case for them. It really is that moms are carrying the mental load. And if that's not you in your household and you're like super dad, amazing, you're crushing it and you're going to change us for like generations, amazing. So this is not a slam on you, but we do have to, I think, at different transition points, even though I would love it for partners to come swinging in and to save us, I really do think that we have to, as women in the workplace and as moms, decide for ourselves, this is a moment where I want to set up what my expectations are, what I want it to be, and to set up what's the accountability that I'm going to set up so that we continue on this path. Like, how often do I need to meet with my partner to decide how's this going? Do I feel like I'm carrying everything? Do I feel exhausted? How do you feel? Like, what do you need? What do I need? I mean, having that continued discussion is the only thing in my mind that's going to change that piece of things over time.
No, I totally agree. We're jumping around a little bit, but we got a bunch of questions. I want to try to hit them all within our hour.
Yeah.
So one,
Okay.
which I don't know, is sort of like on top of my mind too with, sort of younger daughters, but is that, there's been a lot in the news about early puberty and how we're seeing more and more sort of early puberty. So when do you sort of start to think, okay, maybe this is going on with my child, I should seek a pediatrician's advice on it? What's your advice around that?
Yeah. So the normal progression of puberty is that you have breast buds, then pubic hair, more breast bud, more pubic hair, big growth spurt, and then your period if you're a female person. Girls, a lot of times you're absolutely right that it's starting earlier and earlier. We've even seen girls as young as like 7 that are considered in that normal range of things. It does follow in a hereditary pattern. So if you had your period really early, it's way more likely that your child is going to have their period early. We're still trying to figure out within the literature exactly what's making it so that people have their periods early. There are some theories for sure, and a little bit of evidence about like hormones and food and that type of thing. Well, what I would say is if you notice those breast buds or you're worried at all, absolutely talk with your pediatrician. But maybe even more important than that, talking to your kids when they're pretty young about their bodies and how they're going to change makes it so that then when it does change, they'll come to you and let you know. Because I can't count on, like, oh my gosh, so many times where a mom has gone, wait, you have pubic hair? They didn't even know what's happening with their kids, right? So just make it so that the kids and the parents are getting as much information as soon as possible so that they can be the ones that bring it up. The Care and Keeping of You is a good book. That's from American Girl Star. But the other book that just came out this past year or so, which is an amazing book, is called Youology, YOU, from the American Academy of Pediatrics. And it's really good. It's actually just for 8 to 11-year-old boys and girls. And so, or they, thems. And so it is a perfect book to prep kids before anything ever happens, because the vast majority of our kids are going through puberty more like 10, 11 for the girls, and then like more like 13, 14 for the boys. So it's going to give everybody that info so then they'll know what to look for and parents can read it too.
Oh, that's great. Thank you. Yeah, because the care and keeping of you is like the one that sort of I knew about, right?
Yeah.
From having a daughter
From way back.
Oh, but yeah, exactly. So another question that's a little bit more parent focused is came in this idea of I'm the breastfeeding mom. I My spouse feels almost like I'm the gatekeeper to the baby because he's not able to, feed the baby. I'm assuming she's not pumping. What
Mhm.
are some ways to get him involved so that he feels like he's an equal contributor in developing this relationship with the baby as well?
Yeah, well, like I love that he wants to be an equal contributor. That's amazing. Like kudos to him that he's even saying this to you, right? So take
Right?
it to heart. I like to divide up whoever's doing the feeding, they're the feeder in chief. And then the other person is the soother in chief.
Oh, nice.
So your partner's job could be I'm the person that wakes up in the middle of the night when they are crying, or you fed the baby, you pass them off to me. So that way I can do all the swaddling and the cooing and the swaying and those types of things. The other big thing, though, when you talk about being a gatekeeper, is to ask yourself, am I being a gatekeeper at all? I know I totally did this as a new mom. Is my husband would be washing our baby in the bath, and I'm like, not like that. You're gonna drown her, So like, back off, let your partner do it the way that they want to do. Have some tasks that they become the expert on, that you're not the expert on, so that way you don't develop that sense of resentment between you all. That helps a ton. And again, that's a good push for like why sitting down and being like, this is the thing you're going to take care of. This is the thing I'm going to take care of. That makes a difference, because then you both are kind of the CEO of that particular task in that particular role.
I love that. The CEO of a particular task. You don't have to be the
Yeah.
CEO of all the tasks, only particular
No.
tasks.
Yes. And some tasks you don't need on your list at all. Like cross off as many tasks as possible. That's my MO.
Exactly. I totally agree with that. So another question, which I again can relate to as the mom of an older one, but also younger one as well, is how to get children to take medication. Is
Oh yeah. Okay. Oh, this is a tough one. It depends on the age. So, and the situation. So if your child has an ear infection and they need to take the medication, or otherwise they're going to keep on with ear pain up all night, then you really don't have time to be like sweet talking them. Okay. If your child is little and they're refusing it, you got to just like pinch the cheeks a tiny bit, create a little pouch, and just like and get it in there and be done with it. If it's a medication that they have to take every single day, you have a kid with diabetes, you have a kid like mine who has to take a medication that helps with her mood and her anxiety every single day, then yeah, you need to work with them a little bit harder. I don't think there's anything wrong with creating a reward system in the very beginning when a child is getting going on taking medications. That's appropriate. And then once they're in the rhythm of that medication, backing off on the reward a little bit so that it's less and less frequent or less big, so that they're used to it until they hit teenagerdom. And then you're really going to have to like have a whole nother discussion. But for the little kids, that tends to work. Kind of think about it like potty training. Like some kids, they work well with a little bit of reward. Um, most kids are too young for you to try to reason with them and to say like, well, if you do this, like this is just going to prevent you from having this big problem. Like most kids, you could talk until you're blue in the face, but that's not going to make a huge difference. A lot of times it's about them actually getting something out of it. Then the last thing I would say is try to give your child as much control as possible over the situation. So maybe they can't control that they have to take the medication, but they can absolutely control how they take it. I want to be on my bed. I want to be sitting at the table. I want to take it through a straw. I want to swallow it. I want to, have it crushed up for me. I want to have it so that it's at 3 o'clock in the afternoon, right after school. I want to have it before breakfast, after breakfast, like whatever is the thing that you can give your kids some agency around the medication. Again, if it's not something that's like a short term, you need to take this so that you'll get better and not have to go to the hospital medication, I would totally do.
Oh no, that's great advice. I think it's so hard, right? Sometimes when you're like, you're gonna feel better. I know your ear hurts so much in the moment. We just went through this. I know your ear hurts so much in the moment, and you just have medicine that you don't like, but I'm just gonna have to kind of make it a must do because
Yes, exactly.
formation isn't. It's a little too far, right? So I'm just curious as we sort of wrap up, and you've been on our podcast and we've asked this question before, but and I love the answers you always give. Sort of as a mom, a parent, and as a pediatrician, sort of how do you feel like those two roles have influenced each other?
Oh my goodness. Okay, so this might sound controversial, but I mean it in the most loving way. I love my daughter. She's a genius. I really think she's going to change the world. She's one of those kids that's like just thinks in a different way than other people. And she's so sweet to her sister and all this. But if I could choose, I wouldn't choose to have her have autism because of the issues that it has brought in terms of just the struggle and the challenge that we had in our family. That said, the autism, what I've learned from being her parent, has taught me things that I would have never, ever known. So while I didn't kind of choose to carry that package on my shoulders, I still am learning from the climb up the mountain that I take every single day with her and from how much stronger that I get. And one of my people who's a mentor the other day talked about the idea of like friction literally creates power, like friction, like electricity, like that. And it creates power. And about how I think I'm a better mom and a better pediatrician because I had to learn about nuance. I had to learn about how there are principles of being a parent and of being a good like caregiver, but that sometimes those principles have to be broken for the greater good or for the moment that you're in. So I think that's huge. I think that being a pediatrician taught me about just this broad experience that other people have that I don't have. So it taught me to recognize my privilege so much more as a white woman who comes from educated parents and who has resources. It taught me about the way that I think about things culturally as an American versus someone maybe who's from a different country. It also helps me to understand as a pediatrician and seeing so many kids and families about how much the process matters just as much as the outcome. So this is what I mean. When I'm in a room with a patient, I could, in the end, let's say they have an ear infection and I'm thinking that they need antibiotics, because since we're talking about that, I could go into the room and go, I looked in their ear. Yep, they have an ear infection. You need antibiotics. And the parent could go, I'm not going to do that. And I could go, okay. And now I'm kind of lost because I came on too abruptly and the parent didn't do the thing that actually was going to help the kid not be in pain, and this is like a very small example. There's bigger life or death examples too. But if when I'm talking to that parent, we're chatting through in a very thorough way, what were the symptoms? What's going on? What made it so that you came in today? How did your child sleep last night? That helps me to understand where the parent is. And we can make a decision together that actually works for the family to say like, oh, well, I could prescribe this right now, or I could call it into the pharmacy and you could wait. Or we could just wait 2 or 3 days and see what happens. Or maybe it's not an ear infection at all. And I jumped to a conclusion when I went too quickly, didn't go through the process. So I've learned a ton about watching people's reactions, about responding to people instead of reacting. So I think those two parts of my world definitely have made me the professional that I am and the working mom that I am, and hopefully is allowing me, as I speak with families just like right now, to support people in a way that feels holistic and not just like, oh, here's your answer. Because 99.9% of the time, as you know, in developmental psychology, like there's a million confounding factors that play into this.
A million. Also exciting, but also challenging, right?
Totally. Yes.
So that was lovely. Thank you. You know, I just our Q&A, the way I have it set up, I'm just seeing 2 questions now. So I just wanted to hit those before we left. I have been concerned about lead and heavy metal content in baby foods. Which brands and which foods are safest for babies? Their baby's almost 7 months old and about to start solids. And then there was another question, very similar, with an 18-month-old.
Okay, a couple things. First, remember that heavy metals are actually in our dirt. So like no matter what, there are going to be heavy metals that are going to be part of things that we eat. So that's just like part of life. What we want is it not to be too high. The other thing is certain foods, when they have higher skin contact time with the soil, they'll have higher heavy metal exposure and absorption. So like carrots are that way, any root vegetables are that way. So when you're feeding your baby, one of the most important things to do, no matter what brand of baby food you're using, is just to have diversity. Because then there's going to be some foods that are from like branches, so they don't have any lead toxicity or anything. And there's going to be some that are going to be from the soil, and then some that are fish, and some that are chicken, and whatever, right? So like variety is 100% the spice of life when it comes to feeding your kids. And also, we didn't talk about this, but that is going to help lay the foundation as much as possible for having them not be picky eaters long term. Not when they're 3 or 4, but when they get to be like 40-year-olds. That's it. There is a new organization that is a nonprofit called the Clean Label Project. And they have an entire way that you can look and see if they have certifications and awards that they give to different products. So that's actually where I would go to look and make sure that whatever baby foods that you are buying, that they are certified by the Clean Label Project, or they've been given awards there, because those are going to be the top brands. And then the other thing I would do, which is probably equally important in terms of your baby's teeth and then just overall food preferences to these like heavy metals or toxin exposure, is when you're looking at baby foods, you want to make sure that it's the actual food itself and that it's not a juice that's added in. So a bunch of the pouches or things that aren't really high quality, they won't have actual real fruit or vegetables or food in them. It'll be like a synthetic thing. So you want the least number of ingredients in the actual product itself. And then look at that Clean Label Project, because that's going to show you how many like checks and quality and what's the, parts per million of all the different toxins and all those different things.
Oh, that's a great reference. I had not heard of them. Great. Well, I know we're sort of running out of time, but thank you so much. As always, it's so lovely to speak with you and to hear your perspective on all these different things, and super helpful answers for all these questions that I think we want to have time to ask our pediatricians, but often don't.
Yeah, absolutely. And feel free. I'm at Modern Mommy Doc, so feel free. You can DM me. I've been doing this long enough to know that it's never a good idea for me to give you like a specific answer, medical advice to you on DM, but I can 100% give you like general resources or give you like an in general answer, just like I'm doing tonight. So if you have additional questions, I'm happy to help anyone who wants to reach out.
Great. Well, thank you. So thank you everyone for attending tonight, and we have a video, so we'll also send that to everyone in case you missed part of it. So have a good night, and also follow along at your Cooper for those of you who are new to the Cooper space. Bye, Whitney. Thanks so much.
Bye. Thank you.